This was a woman who was 42-year-old who came with a large mass abdomen. She had got a scan done out from where she was referred to us. The scan size of the uterus was as good as an 8-month pregnant lady, so that we would call it as 32 or 34-week size of the uterus. This woman was actually diagnosed with fibroid uterus for a few years back, pre-COVID, and where the size of the fibroids are not really large. So she was asked to have a conservative management, which is the regular treatment. But following COVID, she did not, during COVID, she did not go for any health checks, or following COVID also, she did not feel any requirement of it. But recently she started feeling some heaviness or pain, so for which she went for a scan, and then the uterus was detected to be enlarged. Her concern was she did not want to have a open surgery, and she was insisting on a laparoscopic surgery. That's why she came to us. On examination, we found that the uterus was very enlarged, and we told her that laparoscopic surgery would be difficult considering the size of the uterus and also the vascularity. There are two main challenges when we talk about laparoscopic surgery in such big uterus. One is the access, because the whole of abdomen is occupied by the uterus, and we do not get space to put our instruments, which most of the time is blindly put. The main camera instrument, or the trocar which we put, is put blindly with all the with the tactile sensations, and with our expertise we know how to put and where to stop. So the accessibility was difficult. Next is, considering the size of the uterus, the vascularity is generally very high in this kind of a situation. Technically, the blood vessels which supply to the uterus is as large as only not more than 1 millimeter or 2 millimeter max to max. But in this case, it was almost 4 to 5 millimeter size. And also, how do we remove such big size of the uterus with such small incisions? So these were the certain points which we discussed with the patient. But patient was very keen on having a laparoscopic surgery. But we took a consent telling that if it's not possible laparoscopically, we may have to resort to go for a open surgery. And luckily for us, we could find the blood vessels which were supplying the uterus easily, and we clamped the blood vessels in the first stage itself rather than dissecting anything. And following which we released the uterus. But it took a longer time for us. Generally, a normal total laparoscopic hysterectomy takes half an hour to 45 minutes to an hour max to max. But in this case, we took almost 4.5 to 5 hours. So the reason is, as I said, we were very careful in cauterizing all the blood vessels and to make sure that she doesn't have much blood loss. And also to remove such a big uterus, we had to cut the uterus into very small bits through vagina. Vagina gave us some space, so through the vagina we had to cut it into smaller bits and take the whole uterus out. So uterus was detached in 1.5 hours, whereas the removal of the uterus from the abdomen took us almost 2.5 to 3 hours. Following the surgery, she did not require any blood transfusions, and 2 days after the surgery she was discharged and she came back for the follow-up. Traditionally, when we do an open surgery, the patient requires to stay in the hospital for a longer time, and also the recovery takes very longer time. Considering the incision being longer in a traditional open surgery, there is chance of infections and also formation of hernia in future. Laparoscopic surgery has this advantage that as we do it in a very small holes, which is also called as a keyhole, the chance of infection is less. The time of recovery is very short. Normally, a hysterectomy patient gets back to her work or normal routine by end of 10 days to 2 weeks time. And the blood loss is comparatively very less than compared to the open surgery. So these are certain points about laparoscopic surgery. And this large uterus, if you look at, there is very less number of cases which have been reported in the journals or the papers. If I can remember, I think there are only 1 or 2 hysterectomies as good as 4 kgs been removed. So this is among the largest uterus which we have removed in India.